Hey, good morning. It's Councillor Glen here. Happy New Year, bonne année. This is my first update of 2022, and today I am at Crossing Bridge Park next to Aylorne Cassidy School with the rink behind me. And I wanted to take this quick opportunity to say thank you to everyone in our community who volunteers to help maintain a local rink. We've got about a dozen or so outdoor rinks in Stittsville, and every single one of them is maintained 100% by volunteers. So thank you very much for everything that you do to give us a great opportunity to go out and get some exercise and recreation during our cold winters. And it is certainly a cold day today. I wasn't going to do an update today, but there's enough happening in Ottawa and Ontario, around the world with COVID, that I thought it was important to share some of the updates. There's a lot of changing information up there, and I get a sense that a lot of people are frustrated and confused at what's changing, and it is changing. In the last couple of weeks, some of the things that we've all gotten used to, some of the normal approaches to COVID have almost gone completely the other way. For example, we used to tell you, if you feel sick, go get tested, and now we're saying no, don't get tested, we don't have capacity for that, stay at home. So that's a change in message. We used to say isolate for 10 days. In fact, I think a long time ago it was even 14 days. Now we're saying it's okay to isolate for 5 days as long as your symptoms are getting better. And we used to say, pay attention to the case count. Every day people would look at what are the cases in Ottawa, what are the cases in Ontario, and now that number doesn't really mean that much. So now we're looking at things like wastewater management, and we're looking at things like hospitalizations and ICU usage and so on. So a lot of our approaches and what we're used to around COVID has changed because the pandemic has changed. With Omicron, we're in a new phase of the pandemic, and our response and our actions as a community, with public health, with healthcare, is changing as a result. Before, the strategy was really around containment. How do we contain this? How do we do contact tracing and stop this transmission of COVID? Now, with Omicron, the transmission happens so easily. There's so much COVID in our community that we're no longer in a containment approach. Now the approach is mitigation, mitigating the harm. So trying to protect the most vulnerable people in our community, and also trying to protect our healthcare system from being overwhelmed. So all of the approaches, all of the strategies, all of our actions are now around mitigation because of this new way that Omicron is spreading. So I know some of the messages now, because they're so different, can be really confusing and frustrating, and you're probably wondering what's going on and what do I do. So I want to try to give you some guidance here. First of all, mitigation. When we say mitigation, what does that mean? First of all, that's vaccination. We know that people who are vaccinated tend to have a much milder reaction to COVID when they are vaccinated, and we know that a booster shot for adults gives you even more protection. So Ottawa Public Health is ramping up vaccination efforts and booster shot efforts. I just saw, just before I logged on here to this video, there's been 50,000 additional booster shot appointments added at public health clinics over the next week or so. So if you go on to ottawapublichealth.ca, you can book an appointment. We've also created prioritization for people who are the most vulnerable. So if your age is 60 and up, if you work in healthcare or adjacent to healthcare, if you work in childcare, education, if you're a school bus driver, if you are pregnant, you can get prioritization. There's additional appointments for you and the ability to get a booster shot as quickly as possible. If you if you need a first dose or a second dose, you actually don't need an appointment at a community clinic. You can walk in. So we're trying to make it as easy as possible for people to get vaccinated. The other thing around mitigation, so number one is vaccines. Number two is to pay attention to symptoms. And if you do have any symptoms, isolate for those 5 days according to the guidance on ottawapublichealth.ca. So vaccination and staying home when you're sick are the most important things we can do. It's both about preventing people from having to go to hospital with COVID, because although many people have a mild COVID, some people have more serious COVID and need hospitalization. But it's also about preserving capacity for essential work. So that's healthcare for sure, making sure that there's enough staff available, but also all the other essential areas of our city, bus drivers, people who work in retail. I'm hearing from a lot of businesses who are having trouble staffing essential services, grocery stores, and so on. So it's really important that we stay home when we're sick so we stop that transmission from happening. I have a lot of updates about all of this on my website. If you go to glengower.ca, I've shared the latest guidance and advice from Dr. Etches in Ottawa Public Health. I've shared information about emergency childcare if you qualify. A lot of people in the healthcare sector would qualify for emergency childcare. I've been sharing information about new restrictions, anything that's out there. I've been sharing it on my website, glengower.ca. OttawaPublicHealth.ca is also a great source of information. I wanted to specifically just recognize there are a lot of people in our community who are bearing more of the burden on this than others. For example, kids and parents and students who are affected by school closures. For example, small business owners who've been forced to shut down completely or are being affected by staffing shortages. And of course, people in the healthcare sector, our hospital workers, anyone involved in healthcare, they're working double shifts. They're spending their days covered head to toe in PPE. It's a difficult environment to work in. People who live or work in long-term care homes or retirement homes, they're under a lot of restrictions right now, and really a difficult time to be living there or working there. So thank you. If you're in one of these categories, one of these industries, one of these areas that's disproportionately affected by COVID, our community's thinking about you, and thank you for all of the work that you're doing. Last thing I wanted to mention, I've heard from some people with questions like, well, what if everyone's going to get COVID anyways, why bother doing anything? And I'll say this, it's possible, yes, that everyone could get COVID at some point. We might. I had COVID over the break. It was mild. I isolated I was in the 10-day isolation to begin with. I was lucky that it was mild. But it's still, even if everyone might get COVID at some point, it's not reason to throw in the towel on this. It's still important to get vaccinated because vaccinations will protect you against more severe illness. It's still important to isolate, to avoid contacts with people from outside of your own family, your own household, because we don't want everyone to get COVID at once. That will overwhelm our hospitals. It'll also cause some severe staffing shortages for schools and for many other essential services. So it's still very much helpful and imperative that you go out, get vaccinated, get your booster shot, take all the precautions, and still take this very seriously. We've got a tough few weeks ahead of us, and I'll continue to provide updates, and I want to thank everyone in our community here in Stittsville for what you're doing to support these efforts to get us back to something more normal as soon as possible. It's super cold today. I hope you get out. Just take a few minutes. It's cold, but take 5 minutes, 10 minutes, 15 minutes even, just to take a walk around your neighborhood, get some fresh air, get some exercise, enjoy some of the sunshine, maybe get out to skate, cross-country ski. Not quite enough snow maybe for cross-country skiing, but please do continue to get some exercise. It's great for your physical health and for your mental health. And I'll look forward to talking to you next Saturday morning, maybe from another local rink here in our community. Take care. Have a great day.